I got the opportunity to do my internship at HCA Sports Medicine Clinic and Thomasdale High School. My preceptors were Michelle Tyler, who's an ATC and a PT, who also works with Kent Horner, and then my other preceptor was Mike Polia, who's the athletic trainer at Thomasdale High School. This is HCA Sports Medicine Clinic. These are all the different equipments that they have. To start off with, these are the arm bikes that most of the shoulder injuries patients use, and also some of the back pain patients get the opportunity to use. And then these load tables are used for different table exercises and also for ACL patients to get stretched. And then this piece of equipment is a Pilates machine called the Reformer, and a lot of ACL patients use it. There's a bunch of different exercises that go along with it, and also SI patients get to use it. And then this is the quad extension machine, the hamstring curl machine, treadmill, and also leg press. The leg press is usually used within the 1 to 2 weeks of a patient coming back with an ACL reconstruction, and the Reformer is used for that also. They focus more on the core with the Reformer. And then over here is where the Swiss balls are. A lot of patients with SI dysfunction or shoulder injuries use Swiss ball, and this back area where the speed ladder is where they do sport-specific activities, and also that back hallway is where they push the prowler and the sled. And also some of the athletes get to go outside and do outside hurdles, and also they have sport-specific exercises outside depending on the weather. And then also sometimes if they're working on a work-specific job, we have a firefighter that's doing that right now, and they flip tires. They also hit the bag with a jackhammer, and they also had to flip a telephone pole. It's all different sports work-specific jobs that they have to do that can allow them to return back to work in a strong and support and well-mannered way. This is Thomasdale's athletic training room. This is for the winter and spring athletic training clinic, and they have a separate one for the fall for the football season. That one's a little larger, but that's also in the football locker room, so no other athletes are allowed to use it. Also, this has a little bit of rehab equipment over here, and as you can see, these little boxes down here are the first aid kits that each sport is given during the season. And over here is the field, the football field, which during the spring season is soccer's played on and also lacrosse is played on. So that's where we spend most of our time for the spring season. And I also got the opportunity to work basketball games, and it is my first time working lacrosse, girls lacrosse, which I find is very interesting. At HCA Sports Medicine Clinic, we have a lot of patients that come in with ACL reconstruction. A lot of them come in for pre-op, and then they return post-op, and it's amazing to see how fast that they can regain their motion because they did the pre-op. And then also we see a lot of rotator cuff surgeries and bicep tendon ruptures. And those patients, it takes a little while for them to start doing exercises that are more specific, and because of their limited amount of strength that they have and the amount of pain that they're in. Also, we have a lot of patients with SI dysfunction, and the main focus for them is to make sure they have symptom control and pain control. And also with low back pain, their main focus is symptom control and pain control and to focus on exercises to help strengthen those muscles. And also I got the opportunity to watch surgeries. One of my favorite surgeries that I watched was a bicep tendon rupture, and they cut into the top of the arm and they couldn't find the tendon, so then they had to cut another incision in the middle of the arm, and they had to pull the tendon all the way out of the skin and then pull it up to reattach it to the top of the humerus, which I found really interesting with the amount of force that the doctor had to put on the tendon just to pull it up to reattach it. At Thomasdale, some of the injuries that happened, one was a plica syndrome, where the athlete came in with extreme medial pain of the knee and also a pocket of swelling at the tibial tuberosity, but the athlete was not very point tender at the top of the patella where the plica sits, which was very interesting, but she had a positive plica test, and most of her pain was on the medial side a little further down. And then another patient came in with complaining of shoulder pain and that they couldn't bring their arm past 30 degrees, and that athlete had extreme swelling on the AC joint but didn't fall directly on their outstretched hand, but they were throwing a ball from outfield to home plate, and so they went to the doctor and they have a possible labrum tear. And then the other athletes, the other cases that we've seen are concussions, which have been very common, and most of the concussed athletes have been out for longer than 5 days, which is very unusual because of how long their symptoms have been lasting. And then another incident that happened was an athlete came in with patella swollen, twice the size as the other one, and a lot of point tenderness on the tibial tuberosity, and the athlete had IT band syndrome and had a positive test for that, and the athlete was in excruciating pain, so after she had a little bit of rest over a weekend, it came back fine, all the swelling decreased, and it was amazing to see how much swelling could occur just because of IT band syndrome. Some of the experiences that I got to do as an intern, I got to do Hit the Hill for athletic trainers to talk to senators and delegates, and then I also got to speak at the Specialty Center for Chesterfield County Schools to talk to the PT/OT class. Me and Mike talked about athletic training and what it takes to be an athletic trainer and all the different extreme injuries that occur. So it's very cool just to talk to high schoolers about athletic training and hopefully get them more involved and to know more about the career. At Thomasdale, I got the opportunity to rehab a couple of the patients. Some of them were ankle sprains, one of them was a stress fracture, and the other one was a quad strain. These athletes got to do circuits. This one did a circuit on lunges with a slide board and then agility ladder, and then also got to do step-ups. The stress fracture that I got to work with, I had to come up with exercises that were sport specific for a non-weight and bearing athlete, which took a lot of creativity in making exercises for a soccer player to not be non-weight bearing. And I also got to help with a quad strain that has been reoccurring. So the main focus was to focus on the quad and the abs. So I really enjoyed doing rehab for all these athletes and learning different exercises that could really help in the future for dealing with athletes with these simple injuries. Would I do this internship over again? Yes. I've gotten the opportunity to learn so much, and I've learned so much about how to treat athletes and how to evaluate in a quick and efficient way from the high school. And I also got the opportunity to do on the field and off the field evaluations and rehabilitation plans, and allowed the athletes to go through functional testing just to make sure that they're ready to return to play. And I've also got the opportunity to watch an ACL functional testing, and I got the opportunity to also do an ACL functional testing on an athlete at the clinic. And this experience has really taught me what I need to do as an athletic trainer if I have my own team, and how important at a high school setting it is to just go through and evaluate as fast as you can, but be efficient, and to recognize the common mechanisms and common injuries that the athlete reports, and to make sure that they give a home exercise plan just so that they can do it on their own. And also, I really liked the opportunity of working games because I've gotten a lot of experience from that, just growing as an athletic trainer and what to do when something happens. And I think this internship, even though at some points I've had to wake up at 3:30 in the morning and not get home till 10:30, it was totally worth it just because of all the experience that I got. And yes, there are hard days with doing that situation, but it's totally worth it in the end, and I would definitely recommend anybody that wants to work at a high school setting to definitely look into this as an internship opportunity, because the amount of stuff that you learn is amazing. To think that I've only worked there 12 weeks and how much I've grown in the 12 weeks.